I understand.
Okay, so she didn't say just Robin. Hi, everybody. Welcome to another week. This week we have a very wonderful guest and someone I've known since she's 12, I think. Um, Dr. Robin and I worked together when she was really, really young at San Diego State. I've known her dad forever. She happens to be my wife's sister, so full disclosure. Or actually, Jenna is Robin's sister because yeah. Anyway, okay. So this week, I really wanted her to come and talk to us and about becoming a psychiatrist. I know that three or four of you wanted to become psychiatrists. I know Summer, pointing at you, wants to become a psychiatrist. And so I happen to have one in the family that is amazing. So what we're going to do is we're going to listen to where she came from, and I have your questions up here, and I'll kind of jump in occasionally to poke your questions at her. All right, so take it away. Oh,
Okay. Well,
more
I
than
guess
just
I'll
Robin,
start
though.
with
You are
how
introduce
this.
your full self.
Okay, I'll start with how this journey all began. I would say as early as age 8, I knew I wanted to be a doctor. Now that kind of morphed as I matured and got a better idea of what all of that entailed. But I held with that dream and passion when I applied to undergrad. So I did my undergraduate at Cornell University, which is in New York. Came from San Diego, so it was a big journey, but I felt like I needed to experience something that was culturally different. Um, when I got there, I registered for all the pre-med track, which is a group of classes that you take, not necessarily a major. Some schools have a major. Cornell didn't happen to. But I decided to major in Spanish literature. That's because I love literature and I love Spanish. And I also wanted to see the kind of small side of Cornell. Like I had classes in these big lecture halls, and I also had like classes of 3 people in professor's office. So I really felt like that diversity of education made me a more complete person. So it was important to me. It was also important to me to study abroad and live with the family. So I did that as well, living in Sevilla, Spain. So long story short, I came to the end of my undergrad and I took a gap year. I actually taught high school for that year, which was a lot of fun.
I forgot about
And
that.
yeah, so
I,
it was
I
just a
remember now. Yeah.
yeah, it was just a small private school, and they had me teaching chemistry and biology. It was a lot of fun. So I was in application that year to medical school, and the application for medical school is fairly grueling. You take a test called the MCAT, which is an intense sort of test, and you have to score above a certain threshold. I think the scoring's probably changed since I took it.
What are the topics
And
though? So like, is it just general science knowledge or general physiology knowledge or what is it?
there were specific sections, like there was a physics section, there was a verbal section, so there were more specifics, but it was, I would say, a combined science with higher level SAT or GRE.
Okay. Okay.
Um, so I applied. At that point, I was a New York State resident after being at Cornell that time and teaching. So I applied to the New York State medical schools. One, I didn't really want to get buried in debt. Like my colleagues who went to private medical schools came out with like $500,000 in debt,
Wow.
and I came out with 100,000. So there's a big difference whether you choose a private or a public medical school. So I chose SUNY University at Buffalo, which is kind of the flagship of the State University of New York system. It's kind of like our UC system, but in New York. Not quite as prestigious as the UC system, but still very reputable.
But in
Um,
some cases, though, the SUNY system is more reputable than here. Like where you went in Buffalo, that's one of the top psychiatry places in the United States.
yes, although I didn't know that when I was applying at the time.
Yeah, I'm just saying, it's just like it happens to
Yeah.
be where the a lot of the initial research and a lot of the initial stuff that we talk about in psychology comes from that area. So
Yeah.
it's a big deal in psych, just so okay.
It was, yeah, a blessing I didn't anticipate. So I start medical school, and the way the medical school works is that you do 2 years in the classroom. So just getting lectures on all sorts of detailed things. Some med schools have a problem-based focus. Mine was you're gonna learn biochem, you're gonna learn anatomy, you're gonna be in the lab, you're gonna do all of this stuff. Medical school in itself, those classroom years, there wasn't any material that was particularly hard, but it was the volume. So it was the
Right, right.
equivalent of taking 26 credits of graduate science courses at a time.
Ooh,
So
geez.
it was just you were just being inundated constantly with new stuff. So I got through those 2 years, and then you do your clinical years. And in your clinical years in medical school, you rotate through all the major specialties. At that point that I started, I thought I would probably do a subspecialty of internal medicine, maybe something like oncology or allergy or endocrinology. So I started my rotations. I did pediatrics first, loved it, thought it was great. Then I did OBGYN, also loved that. But I had one of my attendings there tell me, yeah, I don't even know my kids. It's my nanny's raised them. And I thought for me personally, that's not the path that I want, the family life that I want. So I kind of struck that one off the list.
Why does that
Then I did
require
my
so much
internal
more
medicine
time?
rotation. So this is
Why does
what I
that one
was like.
require some, wait, sorry, Rob. Why does that one require so much more time? Just because of the amount of dedication you have to working with kids, or is it?
For obstetrics, you're depending on what kind of practice you choose, but a lot of them chose practices where they're on call all the time.
Oh, right, right. Okay, that
So
makes sense.
most people want to have a particular doctor deliver their child.
Got it.
And so no matter when you're going to have that child, that doctor's going to come. Now, it works differently in some systems like Kaiser, where you just get who's on that day.
Right, right,
Um,
right.
but in that system, you're the OBGYNs were on call all the time.
Okay, yeah. So you have to think of the end game. I never thought about that. So the end game of where you're going is also a really important part of your choice, not just following your passion.
Absolutely. You want to have the quality of life that you that will make you happy and sustain you. So medicine is a grueling field, and there are people who work consistently 80-hour weeks and or 100-hour weeks, and that's entirely their whole life.
Wow.
I have a friend who's a surgeon in Florida, and yeah, she works in upwards of 80 hours per week. She goes home, she has her cat, but that's really all she has time for.
Wow. Okay.
Yeah. Okay, so then I did my internal medicine rotation. And again, that was what I expected to be applying to residency for. And my attending was, yeah, not the nicest. Let me just say it that way. This guy, like, for example, told one of my classmates that they were fat. He cut the tie off another classmate, just snipped it off. And he told me, "Hey, Robin, that's the ugliest name I ever heard. Like, what are your family thinking?" It was so confrontational and combative the whole time. And I would cry every day on the way. So I was really not knowing what to do after that rotation. And I happened to go and do my psych rotation next. I didn't expect to like it at all.
So you came from a horrible situation back to psych and like, oh, this is awesome.
Yes, and the attendings there were like, "Hey, you must take lunch. You have to like take care of yourself." There was a much different compassion about living and a much different average person in that field than there was in a lot of the rest of medicine. So I
Interesting.
did some inpatient work and I did some outpatient work in that rotation. And I just felt really fulfilled and happy. Like the social factors and everything going on beyond the strict medical factors really intrigued me. And that's what I got to spend my time focusing on. So I had a blast and I had to kind of reconcile with, oh yeah, like, psychiatrists are always like the crazy ones, like only the crazy students go into psychiatry. I mean, that stigma was very much alive. Um, I had an aunt that told me I would go crazy if I went to psychiatry. It was a, a stigmatized sort of lesser branch of medicine in a lot of people's minds. some of that stigma has changed, but some of it is still very prevalent.
Yeah.
Yeah, other doctors in the hospital, when they consult you for things, um, they're kind of, some of them are kind of demeaning until they have a patient acting out, and then they love you because you can handle it. So I ended up applying to residency in psychiatry. So you do 2 full years of clinical rotations. Your fourth year of medical school, get to do some specialized work in psych. And every time I got to do a psych rotation, it was fulfilling. I felt like I had found my place.
Okay, so when you do your when you're doing your residency, do you get paid?
Yes. So after the 4 years of medical school, you graduate and you're officially MD. You are a
Okay.
doctor. And then you do your first year of residency. The first year of residency is called your intern year. So you're referred to as an intern,
Right.
and which is like, the pond scum of the medical hierarchy. Like,
Hold this.
yes, less than the person who's, scrubbing the toilets, I would say.
Yeah.
In hospital slave labor, but you do get paid. At that time, because I was living in Buffalo, it was a sustainable wage. I wasn't living high or glorious, but I could pay my rent and eat and buy pizza when I wanted to.
Right.
So,
Okay.
yeah, so I was not at that point taking out any loans, but you do defer your loans from medical school during that
Okay.
time.
Okay.
So then psychiatry happens to be a 4 year residency. Different branches of medicine are all different years. Surgery is 5, OB is 4. Like it just depends on what you specialize in. The shortest ones for internal medicine are 3 years.
Okay.
Also, within that intern year, psychiatrists do a lot of neurology. And I actually started my intern year with a neurology rotation. There was my very first day as a doctor in the hospital. I was at a VA hospital, and the regular neurology residents, as in those who were going to specialize in neurology, had gone off to their teaching. So they had some afternoon like lectures or whatever. So I was the token neurologist on call,
Oh.
and somebody came into the ER with a stroke. So they called a code. So,
Ooh.
yes. So I'm running to this code going, oh, this is my first day as a doctor. How am
Day
I?
one.
Yes.
Yeah. Okay. Is it a clot
What's going
buster or
on?
is it a not clot buster? I don't know. It's like, okay.
Yes. So
Yeah.
I got through that, and one of the other neurology residents arrived shortly thereafter. So it all went okay. But there are definitely those moments.
Yeah.
They joke that you should try to avoid the hospitals around July because that's when the new residents start. Better
Oh,
to
geez.
wait till fall. Yeah.
You're gonna have a stroke. Don't have it in the summer.
Yes. Yes. And get the real neurology resident, not the psychiatry one.
Wow, that's scary. Okay, but so, well, so what did you know kind of what to do? I mean, you obviously because for the folks at home, Robin's really smart. She just remembers everything. But when you have to like do, it's different than knowing stuff. So when you get to
Absolutely.
so when you get to that situation, it's like, okay, I can run the schematic of everything I'm supposed to do, but how do you make, that's terrifying. Okay.
And also remember that, your logic center is effectively turned off because you're in flight or fight mode. I,
Yeah, you get so stressed you can't think past
yes,
your own face. Yeah.
the same thing that happens when somebody gets angry or really scared, right? You can't process things logically.
Right.
Um, so you just have to kind of go on memory and just do the steps because you know the steps.
Yeah. In my cognitive class, we were talking about the difference between knowledge and wisdom. And
Yes,
knowledge is all the details, but wisdom is when you kind of are able to make choices really quickly based on just what feels right, but that's based on the knowledge capacity that you have. And
right,
so, and
right.
so, yeah, day one, you got tons of knowledge, but you got no wisdom. Yeah.
Well, there's a humbling sort of wisdom. I think when you get knocked down a scale or two, realize what you don't know. I think that's probably getting rid of pride is really a very effective wisdom, I think.
So you through that first internal medicine resident or the doctor needs to get rid of a lot of his pride. because he's
Yes,
constantly in
yes,
that. Okay,
yes. Okay, so yeah, then I did my next 3 years in psychiatry. You rotate through inpatient, outpatient, ACT teams, which is when you go out into the community to deal with people. You go into the criminal system and do forensic psychiatry.
okay,
But I was happy doing all of it. And when I came out, I just felt like I had found my fit, and
awesome.
this is what I was going to do. So again, those 4 years, I'm an MD. I'm practicing. I'm getting paid, but a little.
Right. You're able to live but not start to pay back anything yet.
Yes,
So yeah.
and I do know some colleagues whose kids are going through the residency system in California, and my colleagues are really having to help them out because the cost of living with the
Yeah,
residency wage is not even. So it really depends where you do residency.
got it. Okay, so let's fast forward. You moved out to California, you got a job at Kaiser Permanente. What was your day-to-day like life working as an, is it an HMO? Is that the right way to say it? Or is it Kaiser's a little different than HMO?
It's a little bit different. It's a very old system that came from the shipbuilders and Henry Kaiser. I won't bore you with the details. Um, but so I had patients from 8:30 in the morning until 4:30.
So like a nine to
And
five job, basically.
yes, exactly, exactly.
Okay.
I would have a half hour for lunch, which I would throw food in my mouth and keep working on my notes. Um, for some appointments, I had a 30-minute follow up. And for new appointments, I had a 50-minute intake, which is generous compared to some other systems. It's
Okay.
more than you would get practicing at UCSD, for example. But what happened is that I kept every day getting two new patients.
Every day, two new patients.
Yep. And so I kept getting new patients plus inheriting old patients, getting transfers. And so I did that for about 13 years. And at the end, I had thousands upon thousands of patients.
Yeah, and this is and as a there's a client confidentiality. But whenever I would say, "Oh, my sister is a psychiatrist," people, "Oh, what's her name?" I go, "Dr. Robin Warner." She goes, "Oh, she's my psychiatrist." This happened to me over and over and over again. People that I know, people, and it's just like, and it's if people would go to Robin because you're a little special in what you do, because people tend to respect you and the way that you listen and everything else. So for the folks at home, she's really good. Don't not because she's my sister, but people would say, "Oh my gosh, I can't believe how much she's helped." But okay, so you have thousands of patients. How do you when a patient comes in, how do you know them? Or I know you have a great memory, but can you remember everybody?
Um, typically, and I would always put in my notes some clues to kind of jog my memory.
Okay,
Um, Interestingly enough, I would put pet names in my notes because people like to talk about their pets, and that was a real connection point. But for the most part, if I had seen a patient twice, then I remembered them.
that's amazing. That's awesome. So maybe that's what the MCAT's for, to make you that kind
Yes.
of person that makes you remember all that stuff.
Well, I think what my success in psychiatry has really been because I form relationships and really care about people.
Yeah.
That's really the only difference. It's not because I'm smarter or better at this skill or that. It's just that my patients know that I care about them and I have their back, and so they appreciate that.
Right. And so later on in the class we'll be talking about some different therapists, and you'll hear that over and over again. It's when it's that client patient trust. It's really hard to find that at a big hospital where you go in and make an appointment and you see this person for what, 30 minutes. How
Max,
often?
yeah. Some follow-ups are 15, some are 20, and some
Wow.
are 30, but that also includes the time the doctor reviews the chart and writes the note.
Wow. Yeah, so I mean that's it. So that's a really special thing. Okay, so 13 years you are seeing tons and tons and tons of patients. Do you now you've changed a little bit, but do you still see any of the patients that you were seeing before? Have you kept any on, or have you kind of passed them on to the next people now that you're in a different space?
very much had patients. I had patients I saw on the very first day I worked at Kaiser. So I held on to patients sometimes that entire time.
That's awesome.
Yeah.
Okay. Okay,
Yeah.
cool. So
So
I'm
that's
just
part of
curious.
the problem. There's a big door coming in, but there's not really a door coming out because mental illness is a chronic thing.
Yeah,
And people may do well and go into remission, but the illness tends to reoccur. So, yeah, we're dealing with something chronic. And so the patients stay.
right. You can just imagine, and this was a big thing a couple years ago. And I don't know if this is why you've changed, but a couple years ago, the psychiatrists and psychologists at Kaiser were like, "Hey, we can't keep doing this. They keep packing more patients in, but not hiring more psychiatrists or psychologists."
Yes.
And so, is that why you decided? Okay, so where are you now? What are you doing now?
Okay. So what happens at that point, many thousands of patients later, is that I was really at a broken spot. That joy of practicing was really gone. To say I was burned out would be kind of a euphemism.
Right,
But the biggest thing was I couldn't take care of my patients in a way that I felt good about anymore because of the volume of them.
right.
So somebody would call with some severe crisis, and my next appointments were, well, I had my schedule was booked out for 6 months, and I would have nothing for 6 months.
And you're like 9 to 5, and every minute of the day's packed except your half hour of stuffing food in your face. Yeah,
Yeah. Yeah.
yeah,
So at that point, I knew that I had to do something different.
right.
So I kind of started looking around, and there were some private practices that offered positions. UCSD had a little bit of a different position, but one of my colleagues at Kaiser who does inpatient, so the hospital portion of psychiatry, was retiring. So I thought, hey, having a pension is a good thing. So I'll try to stick with Kaiser and see how this inpatient goes.
Okay.
And so that's what I did. Now, Kaiser in San Diego does not have their own mental health beds, meaning they don't have admissions for psychiatry at their own hospitals.
Okay.
That has to do with something complicated called being an LPS facility, which is the emergency personnel can drop off any patient at any time. And so Kaiser does not want to be that. And so because of that, they cannot be a psych hospital. It's complicated.
Yeah.
In any case,
Are there any psych hospitals in San Diego?
so UCSD has a small amount of psychiatric beds, which they are expanding at their new Alvarado campus. So they will be able to take more. And then where Kaiser contracts their beds out is a psych hospital called Alvarado Parkway Institute. And that's where I am primarily. Sometimes
Okay.
at UCSD and taking care of Kaiser patients, and sometimes at Alvarado Parkway.
Got it. So you're still in the Kaiser system, but you've shifted to intake or
Inpatient, meaning,
oh,
so my
inpatient. Okay,
day
I'm sorry. Yeah,
now
yeah,
looks like I come in, I see whatever patients were admitted the night before,
yeah.
and
Got
I
it.
do a full assessment and workup, and then I see all my follow up patients. And I would say I see usually about 9 patients. I call family members, do team meetings. There's also a legal component of that job. I do have to go to court and testify, and that has a lot to do with people being put on legal holds. So we have multiple holds in California. The first is a 72-hour hold called a 5150, made famous by a Van Halen song. Um, yes, so we deal with that because we very much want to advocate that everybody has all their personal rights, but yet at the same time, if they're unsafe, to keep them safe.
Right. Okay, so that's interesting. So I didn't realize that because that's so we last week we talked to a forensic psychologist. Well, she's getting her PsyD in forensic psychology, and she does a lot of the assessments and a lot of the she talked about a lot of that same thing. So be would you be considered a you're a psychiatrist, but would you be a are you doing forensic psychology work or you're on the how is
Um,
it different than the forensic psychologist?
So mostly forensics are going to work just specifically with legal cases. A lot of them work in the
Got it.
prison
Okay.
system.
Got it. Okay.
Um,
So they've
or
done
they're
something
gonna
bad.
somebody's court ordered to treatment. They're gonna do that.
Right, right,
So
right. Okay.
I intersect a lot with the forensic system because of these hearings for retention. If you
Right.
put somebody, so you can do the 3-day hold pretty much, um, and it can expire. At that point, if somebody's not ready to go, then you put them on a 14-day hold.
Got it.
So you can release them at any point during the holds, but also at any point they can have a hearing. There is an automatic hearing if you put somebody on a 14-day hold.
Got it.
Again, that doesn't mean you're going to stay 14 days. It means you could stay up to 14.
Got it.
Sometimes that's a day or two, sometimes it's 14 days.
So the forensic person is doing kind of the same thing, except a crime has been committed and they're doing the assessment, and this person is just having some issues, and that you need to help them get to a better place. And that's where they intersect, is because you're doing the same kind of thing, but for different reasons.
Yeah, I only intersect with the legal system as it relates to getting the best care for my patients.
Right, right, right,
Where,
right.
whereas forensics is going to access them because of all sorts of legal issues like court ordered custody hearings.
Right.
And it doesn't necessarily have to be a crime, but something that's involved in legal in some way.
Got it. Okay. Okay. That's cool. Thank you for that. That's really cool. So what does your day look like? What is like, so when you get up, what's your day look like now?
Well, I get up and I have my quiet time and I exercise and I take my kids to school. And then I arrive at the hospital. And usually there's a few admissions from overnight. So I assess those people first. Sometimes they come into us on a hold already. Maybe they tried to harm themselves, or they were expressing those thoughts, or they were posing a danger to themselves and the community because of their behavior.
Right.
Um, so I assess that, validate the hold if necessary. Sometimes people go home that first day. It's not very common, but and then from the moment they enter the hospital, we initiate a treatment plan. Once people are hospitalized, most people are going to need medication. Not always, but for the most part, if your illness is at the severity of requiring a hospitalization, you probably medications are probably indicated.
So how much, this is a completely aside, how much research do you have to do to stay up with what's changing in the med field? How much
Um,
time do you have to spend, or do you have people that do that? I don't mean to say it that way, but do you have people that are following the research that give you advice?
it's really more you do pretty consistent looking through journal articles. The main thing is any new medications that come up, but for psychiatry, because we are a narrow scope field, I'm not having to look at the new treatments for diabetes and hypertension and cholesterol. Like it's really,
Okay,
so the
yeah.
scope of it is not as much as say an internist would have to do.
Okay. Yeah, so it's like a new, like I know that there's a lot of, like a lot of students ask questions about things like the ketamine therapies and psilocybins and all these things. And none of that stuff is super new. I mean,
Yes.
it's been around for a long time,
Yeah.
but it's just becoming popular now. And so that's why, like, do people come in and say, "Oh, I really need to take some mushrooms so like we can really unpack this stuff." And I'm like,
Yes. For the most part, we go with FDA
yeah,
validated treatment.
right.
Um, so they are trying new things, and if something has been research proved, then that is, there's a lot of case studies supporting evidence of its use. Then
Got
we
it.
can also do that treatment, even if it's not yet FDA approved.
Oh, okay, interesting.
There's a lot. The FDA is really that getting meds approved and stuff is a very complicated system. So there's a lot of stuff that we do, which is quote off label.
Yeah, that's like Botox and that kind of stuff where I mean, obviously for not for psychiatric treatment, but it's like, yeah, it's a muscle relaxer, but we use it to make our faces look younger. So,
Um, yes. So an example would be for PTSD for trauma, we use a blood pressure medicine called prazosin.
okay.
Okay. And we have tons of evidence, especially on military and in rape victims, that this medication decreases frequency and intensity of nightmares.
Oh, wow.
This medication will never be approved by the FDA for PTSD. Not because there's not enough evidence, but because somebody has to go through this really laborious trial and expense of getting it approved with studies. And the medication went generic a long time ago for blood pressure. So nobody's going to make money from it.
Yeah,
So,
so no one's going to put the money into the research, and no one's going to, because if it works and you can prescribe it and it's not going to hurt the patient,
yeah.
right?
So there's a lot that we do that is off label, but if you're doing something off label, you let the patient know, and you also advise them of the research and make sure that what you're doing is research based.
Right, research. Okay. Okay. So you go to the hospital, you do some inpatient induction stuff, and then when you go to the Alvarado, what do you do? Parkway Institute.
Okay, so that is what I do. So Alvarado Parkway, that is the main psych hospital where I admit patients. We have there's about 60 beds there, and
Okay.
Kaiser usually carries about 20 to 25 patients there. Okay, so now I also do a rotation where I do ECT at UCSD.
Okay.
That rotation I do every fourth month, and that is again the Kaiser patients, but we do it in the ORs at UCSD.
Electroconvulsive therapy.
Yes,
Yeah.
yes.
So you now are you doing the modern where they just make one particular part of the brain, or do you do full brain ECT?
We do full ECT. We do it like minimizing all of the consequences by all the research guideline, but
Yeah,
we still in psychiatry, despite the fact that we don't really fully understand how ECT works, it's still the treatment of
it
choice, and
works.
it works in 80% of people that nothing else has worked.
Yeah.
And we're not talking about somebody coming in and saying I'm depressed, oh, let's do ECT. We're
Let's,
talking about I haven't gotten out of bed for 6 months and I cannot function and I've tried 20 medications and I have no quality of life without this.
right. Yeah, so that's a whole nother discussion topic when we talk about ECT, but there's a lot of other like deep brain stimulation. There's a lot of other things, but ECT is the least invasive, the least it's not expensive. It's not and it has like I have one of my students right now in my intro class has had over 30 courses of ECT, and he has no memory. He has a journal that he writes stuff down in because he can't
Mm.
remember stuff. But
Hmm.
he's not psychotic anymore. He is not depressed anymore. And he's very functional.
Yeah.
And then again, but so when you did you have to learn, is that just something you can just go and do, or did you have to go get specific treatment to do that? Not you treatment, but specific education to go do that.
Well, I chose to do a rotation in residency, but of course, when I started the inpatient part of this was, years later. So
Yeah.
I actually did a training with one of the UCSD docs, Corey Weissman.
Okay.
Yeah.
Okay, cool.
But then as Kaiser, we now have TMS as well. And
Yeah.
that's where you target a very specific area of the brain. And for that, they sent us to like a big conference and we had to get all these certifications, et cetera, to do that.
Yeah, that's transcranial magnetic stimulation. Where
Yes,
you put two waves together, where the waves cross, it causes current. And that's really neat for research. I've seen a bunch of research articles about that, and it's you can deactivate or activate a part of the brain depending on where you put it. So
exactly. It's quite fascinating. And of
it's
course,
really
we practice on each other trying to locate just the right spots, trying to locate the motor strip. Very trippy to have a magnet put over your head and for your arm to do this.
yeah,
Yeah.
that's really neat. I've seen that. I've never, yeah, we record EEGs, but we don't get to put the current into the brain. That's not allowed in our IRB approval. Okay, so okay, so then the last thing we want to kind of bug you about before because we have to go make dinner here in a minute. What's the benefit? What are the joys of your job? What makes your job like really exciting and fun to do every day? Because I know you really love your job. do
I
now.
do. There's very few fields where you really get to be there for people in their darkest moments. And to be there and be able to minister to them is, yeah, it's incredibly fulfilling. It's emotionally grueling, but there's nothing quite as fulfilling.
Yeah.
When I left my outpatient and went to inpatient, I had this about 6 month period of kind of saying goodbye to patient. And I can't tell you the number of people that said, "You saved my life."
That's awesome.
I had, in a lot of cases, I had no idea. Or they said, "You said this and you changed my life." Um, it was it was really sobering, to realize the impact you have, and I got to see it kind of this little, snapshot of it in that 6 months of what the benefit had been of my work, and that's really empowering. So there's a lot of hard days. Had days today I was cursed out by a patient. Um, and yeah, I don't want to repeat all of that, but um, for the most part, I get to I get to love on people, and I love doing that.
Yeah. Cool. Eventually, when we get Ted trained well enough, you'll be able to bring him with you and you can.
Apparently, though, this is has a lot to do with all of the litigation that we have in this country. But Ted would actually have to get liability insurance.
Yeah, we have that. We actually, yeah,
Oh,
he
okay.
has it. Yeah.
Yeah, it's
Yeah,
yeah, it's
he gets,
crazy. But
once
I
he
think
gets,
pets are fabulous, and I would love if Ted just walked around with me all day long.
yeah, that's why he's around with me all day long. He's just, we have to carry the insurance until he gets certified. Once he gets certified, he gets liability insurance through therapydogs.org.
Yep, yep, I'll take him.
But he did jump all over you this weekend, so sorry about that, but he's really cute. Okay, so what's one of the things that if you were to say, okay, go ahead, be a psychiatrist. If so, what would you, these most of these students are sophomores in college at this point. Um, I love the fact that you followed your heart through college because Cornell's not easy and you have to have some sort of intrinsic reason to be there. Wanting to be a doctor your whole life, that's great, but that's not going to make you go to class every day. Having that passion. So a lot of students are going to go into, they're looking at degrees in psychology, degrees in counseling, but if you want to go the pre-med route, how do you, is it good to just jump into pre-med, or do they really like people who do other things?
I would say the vast majority of people go right to pre-med, or they
Okay.
do an analogous major like biochemistry or biology.
Okay.
Um, so that's pretty rare to major in something else completely.
Okay.
But yes, I mean Cornell was grueling. So Cornell's a big Ivy League school, and the point that I went there, it was all about getting rid of us. About they set the mean at a D, and they made the test where the TAs would be like, "This test is impossible. Good luck." Um, so it was grueling. I had to be really sure of what I wanted to do.
Right.
And then the whole process, of course, took 12 years, and I ended up in about $100,000 worth of debt. And this is a while ago. Now those numbers are significantly bigger.
Yes.
So, I have colleagues that are amazing therapists, and they got their LCSW. They did it in 5 years and some clinical hours. They ended with little debt, and they get to minister to people too.
Yeah, see, that's the LCSW, the counseling, MFT, not through psychology, sorry folks, but it's through counseling. And
Yeah.
also just getting your degree and doing your hours through an LPC, LCPP, what is the licensed professional clinical counselor? LP,
Yeah, yeah, you can do. There's multiple different degrees in which you can go in to be a therapist,
right.
as I'm sure you've explored.
Yeah, that's
Um,
each next couple weeks we have an LCSW and then we have an MFT and we have a PhD in psychology who's a clinical psychologist. But they all they're all doing the same basic thing, but it's completely different because of their perspective and the way they look at it, and it's
yes,
it's still the helping thing, but it's really
yes,
cool.
I have a very medical point of view. Now, I happen to be somebody who does a lot of therapy too,
Right,
which is not that common with a psychiatrist. But and most people look at us that they do the drugs.
right,
Um, so if your heart is in therapy, I would go a different route,
right.
only because it's very grueling, and you're gonna if you want to do therapy, you're gonna get to the same place with a lot less work and expense.
Yeah. And then so the last, like, I remember when you first came back out to California after Buffalo, you said that you could have gotten a job as a prescription pad, where you could have gotten a job working with an HMO, writing psych prescriptions for significant portions of money. I remember how much some of the salaries you were talking about. But I know
Yes.
that you didn't want to do that because that wasn't where your heart was.
Yes, there's a wide spectrum of jobs, and there are, as with every field, there are good doctors and there are doctors who are in it for the money.
Right,
And I mean, there are doctors who open ketamine clinics and they probably shouldn't, and they're not even really keeping data, and they make a killing.
right.
That's not where my heart was. It's great to be able to support my family. Um, so I would say that Kaiser is kind of on the intermediate end, not quite as lucrative as private practice, but not something like UCSD, which when you go into academic settings, you definitely are paid the worst.
Yeah, it's funny how the private money is the most and the public money is the least.
Always,
Yeah,
always. Yeah, yeah.
yeah.
But yeah, I'm happy to at any point answer more questions. I do also want to note a lot of people ask me, like, should I become a therapist or should I become a psychologist? And I think that's an important question. Practically in clinical work at Kaiser, the PhD psychologists, they do neuropsych testing.
Yeah, that we had that discussion because so last week, Rima she's becoming a clinical psychologist, a forensic psychologist. She is all testing, 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 testing. Oh, I can administer this test, I can administer that test, I can administer this test. The week before we had the MFT, and she goes, "Oh, I can look at where they're coming from, and I can look at we spent a whole semester talking about Maslow's needs and putting people's needs on these charts and figuring out where these people's boundaries are and what type of therapy would work best." And Rima's like, okay, this test indicates that this test indicates that. And it's like the school psychologist versus the school counselor, you know, it's like the school psychologist is testing and testing and testing. And the school counselor is listening.
Yeah, a dear
It's like,
friend of mine, her son asked me today, like, should I do a psychologist? Should I do the therapist route? And I said, a lot of times PhD psychologists are pigeonholed in that testing. And if they don't do that testing, if they just take on a regular therapy role, they do the exact same job as a master's level for the exact same pay.
yeah. And it's that, and that, so I mean, again, this is the philosophy of psychology is that we started a science to try to measure stuff. So when you get your PhD in psychology, it's all focused on measuring stuff. The research lab that
Yes.
we have, it's measuring stuff. And that's exactly what we do. And that's why counseling and other places are where the more helping fields, because they're taking what we do and say, okay, great, thanks for doing that. We're going to use it over here.
Yeah. Yeah.
And okay, I have to go make dinner and I've wasted enough of your time.
Okay. But I do
Oh,
want to tell your students, bless you for considering mental health. We need you. Please come.
okay, so when we stop recording, my wife wants to talk to you for a minute.
Okay.
Okay, but should I say that on the recording? Oh, I just did say it on the recording. I'm embarrassing my wife. She's standing there, she's looking annoyed. Okay. Um, okay, so the second part of that, so tell them about your book and why you wrote it, because that's really important.
Okay, so in the midst of that, having thousands of patients, part of that was COVID, and we saw a huge influx of people into mental health. A lot of it had to do with their community being taken away. I won't go into all the reasons,
Right.
but I had so many people who needed mental health care that could not get it. And so at that point, I wrote a novel. And it was based on the 5 most common things that come into my office. I created characters around them. And they went to a mental health recovery center, and it was their journey back from sometimes a suicide attempt, something pretty severe, and coming through that role of healing. So the idea was, this is what therapy looks like. It's not scary. This is the portion psychiatry does, and how we help each other heal. So that was the novel. And then just this past fall, people in my faith community ask me questions all the time. Should I medicate my child? Uh, what is the hospital like? I get inundated with the same questions hundreds of times. So I just sat down and wrote really practical, sit at the dinner table kind of conversational answers to all of those questions.
Awesome.
And so that's the latest. That's the latest book that's nonfiction. I would love for you guys to follow me at Robin M. Warner. Please help, because publishers want tons of followers. So any follower helps.
I'll post the link when I post the recording here so you can see it. But again, but the reason I wanted to say that is because you started out because you have a passion in literature. And here you are 30 years later, you're using your passion in your practice to that's how you're wrapping your brain around this, trying to unburn out yourself.
Yes, the creative piece. And I mean, to be truthful, a writer was always inside of me. I
Well,
mean,
yeah, you've always been a really good writer. And but that's why you went Spanish literature.
yes,
And that,
yes.
I mean, that's so it's just really I want you, this is why I say this to the folks that watching, is that you have to stay true to who you truly are. You can follow a path, you can follow a lead, you can go wherever you go, but yourself, that core self is still there. And you don't have to give up that core self to follow a dream. Your core self is still present and activated and anyway,
Yeah.
and super there.
Don't do any particular job. You pick something based on your heart, because then you'll be happy in life.
Yeah, exactly. Okay, so evidently my wife wants to talk to Robin. So
Okay,
bye everybody. Thank you so much, Robin. I really appreciate
my pleasure.
your insight and help. I'm going to stop the recording.